Please don't fall in love with the social media people that we see, or actresses and actors who do this at a young age, and you see that contour and you want to go mimic that. What happens to them 5 years later is they look, instead of 30 years old, they're gonna look 40 or 50 years old. Buccal fat pad removal is a very complex type of procedure that doctors and patients don't fully understand all the time. The buccal fat pad is a very smooth, stem cell rich fat pad, also called Bichat's fat pad, that's found here in front of the masseter muscle in this buccal space, and it slides around. There's nothing that can ever replace it. So if you're gonna remove it, you gotta be sure you know what you're doing. The main reason to remove it is if somebody has an overly full face, not when they're 16 years old, but when they're like 25 and above, and it would have shrunken down over time. Anyways, if they have an overly full round face, you can go from inside the mouth, make a little poke incision, take out maybe half that buccal fat pad. You never want to overdo it because you need that buccal fat pad. It's a support structure. It moves around, it slides, it glides, it separates the outside of the cheek from the inside of the cheek. They need to remain separate. You can't take it out and get those things stuck together. The other thing it does is supports the lower part of the face. So if you remove the buccal fat pad aggressively, you're gonna cause a hollowing and a drooping in this part of the face prematurely. You're gonna age someone rapidly and you'll never be able to fix it. The buccal fat pad cannot be replaced. So you have to select wisely on who we do it on. And I love to recycle that buccal fat pad if you can. You take the buccal fat out, you mince it up just a little tiny bit, put it in a syringe, and you can inject it back into the face, in the under eye, on the cheek, anywhere around there to give a little bit of upper face support when you do that. I also like to combine it with radio frequency treatments so I can take out a little less buccal fat and count on the radio frequency to tighten the face instead. Be cautious about removing buccal fat. It's a beautiful thing to do if you know how to do it and you do it conservatively.